Hey guys, what's up? This is Stephanie and welcome back to my channel. So in the video today, I'm going to be discussing why did I decide to do a critical care medicine residency. So if you haven't seen my previous videos, I applied to a critical care medicine residency and I was accepted, which I'm very, very thankful and very, very happy about. I'm very blessed because it was very competitive to get in, and it's a very good hospital where I'm going to be rotating at and doing my residency at. Actually, I'm going to be rotating multiple hospitals. And just real quick about the residency and just kind of what was the whole time that I spent applying, when I get the interviews, how many interviews, for those of you who are interested in applying to residencies after PA school. So I graduated in December of 2020. I applied to a residency in critical care medicine in February of 2021. I got an interview in March, so the following month after that, and I actually interviewed with two individuals. So I had one interview with one individual, and then I had a second interview after that with the second individual. These were all through Zoom because of the COVID-19 that we're in, the COVID-19 era. So after that, they interviewed, so for that interview, they interviewed 30 people. After that, depending on whether they had candidates that they like, they were gonna pass on to the third interview. And so I was invited to a third interview a month later, which was in April. So I was invited to that last interview, and I was interviewed by one individual. And then after that, about a week later, I was notified that I was accepted into the residency of critical care medicine residency. And now I'm actually recording this in May as of right now. And so I've been completing the onboarding things, of course, that are necessary to be hired as a PA to be in the residency. And the thing about this residency, it's going to be a 12-month residency. So it's 1 year. It's going to be including 13 rotations. And those 13 rotations are going to be through a majority of critical care medicine residencies, which are going to be including your medical, ICU, right? Your surgical trauma, post-transplant. You also have women's. So it's going to be 13 throughout several hospitals and specialties like I discussed. You get 2 electives, so you're able to choose whatever you want to do those 2 electives out of the 13. So 11 are going to be assigned, 2 are going to be elective, and we're going to be alongside residents. So I will definitely let you know how that goes once I start the residency. I know I'm going to be having a very huge workload. I'm going to be working a lot, so I'm expected to work 6 out of 7 days a week and 60 hours every week. And then of course you get paid, so you get your stipend. So I'm really, really excited to start the residency. And the reason why I decided to do residency is that during PA school, I had my heart set on emergency medicine, because prior to PA school, I worked in emergency medicine for about 5 years and I enjoyed it. I really liked it. And I thought that's what I wanted to do as a PA. But when I started my clinical rotations, I did my ER rotation and then I did my internal medicine rotation, which I did in critical care. I really loved that rotation. And so I decided to do my capstone, which is kind of like an elective rotation. It's like a 3 to 4 month elective rotation. And so I did this in the burn center in critical care. And so I loved that rotation so much. I loved so much about it. So it's like I got a taste of critical care medicine during my internal medicine rotation, right? And then I got a bite of it during my burn rotation, and I wanted the whole thing. I wanted to learn as much as I could. So that's why I ended up applying to a critical care medicine residency. PA school prepares you well, it really does. But I think there is a huge knowledge gap for critical care medicine. And I definitely did experience that during my rotation in the burn center in critical care, was that huge knowledge gap. And I know that's what I'm going to experience during my residency, and I know I'm probably going to get a lot of hate from individuals saying that it's not necessary to do a job in critical care medicine, residency in critical care medicine to get a job, but I decided to do one. It's elective, right? It's not required, but I wanted to do one because I want to gain more knowledge. I want to get more experience and more training hands-on in regards to procedures. So with this residency, I'll be getting more hands-on on procedures, more training on procedures. I'll be working alongside residents. And so that's what I really like about this rotation also. They are really gonna teach you how to ensure you do well and you treat your patients well. how to ensure that you develop. For example, one of the things I really liked about this residency is that they practice with you how to have those end-of-life conversations with patients. And that's something that you really don't learn in PA school. You go over it, but you don't spend a lot of time. And that's one of the things that I really liked about this residency. So I'm really excited, and that's one of the reasons why I decided to do residency, is that I really want to learn as much as I can and get as much training and experience as I can during my residency. In addition to that, as a new grad, it's really hard to get a job as a new grad fresh out of PA school in ICU or critical care medicine. Very difficult. So that's another reason why I decided to do a residency. It's because you have a better chance of getting into a job in ICU once you've completed your residency. And then on top of that, most of the residencies will hire you if you do well, of course, after you've completed the residency. So that was another huge plus of why I decided to apply to residency. And then if you are in a situation like me, I know certain areas of the US, it's getting a little saturated with APPs, so advanced practice providers. And where I completed my program, that area is definitely getting very saturated. And I can say that because a lot of my classmates who have been applying to jobs haven't had any luck since they graduated from PA school, because it's just hard for new grads, especially during this COVID-19 era, right? For new grads to get a job, because the doctor has to invest time in you, and then of course you can be practicing under their name. So those are some of the kind of things that you're gonna have to overcome as a new grad. So that's another reason why I decided to do a residency, but primarily because I want to learn more, get as much training as I can, experience, learn a lot about procedures, right? And ensure that I feel good when I'm practicing, right? Although, of course, with critical care medicine, you're learning every day. You're not gonna learn everything, but as hopefully once I finish this residency, which I expect to feel, is that I'll have a lot more knowledge and I'll feel more comfortable in treating patients. So that's one of the reasons why I decided to do a critical care medicine residency. So for those of you who are interested in completing one, definitely look for them. Search online. That's what I did. I searched online and I found this residency and I applied to it. And yes, this is the only residency I applied to. I tell myself if I don't get into this residency, I'll get a job and then I'll try to apply later. But it's better if you can apply once you're fresh out of PA school, because once you start working, right, you start seeing that money that's coming in, and then you won't want to go into residency, because of course residency pays a lot less than what you would be making if you were practicing as a PA. But hey, I honestly don't mind what I make. I just want to learn and ensure that I am providing the best care that I can to my patients. One of my fears is injuring a patient, and that's why we take the oath, right? You want to do no harm with patients. So I want to make sure that I do no harm with my patients, and I know what I'm doing with my patients, and I feel comfortable. So that's why I decided to do a critical care medicine residency. All right, guys, I hope this video was helpful for you guys. For those of you who are wanting to do a residency, there's residencies in a lot of specialties. Emergency medicine is another one. Critical care medicine residencies, surgery residencies. I've even seen some residencies in neonatal. So neonatal care, like your newborns. There's a lot of residencies for that also. If you're interested in pediatrics, I would definitely recommend that also. So there's residencies in a lot of things, and it's up to you if you want to apply to them. I know a lot of students don't want to, because of course there's a lot of student loans that you have, so you want to make sure that you're paying for them once you graduate. But the thing about doing a residency is that you can actually, if you do a residency, you don't have to start paying your loans until after you complete the residency. So that's a good thing also about completing a residency, if you're worried about paying off your loans. Alright guys, as always, I hope this video was helpful for you guys, and if you have any questions, comments, concerns, feel free to comment below, and I will talk to you guys later. Bye.